This is mini lecture 3C. We'll be looking at chapter 16, the communication process. Communication involves the sending of messages between sender and receiver, and it is considered successful when the receiver of the message understands the sender's message as intended. It is so important to have excellent communication in healthcare. These are complex delivery systems with many layers of patients and providers, and there needs to be accurate and clear communication in all of these different networks. Payment systems are more complex, and because patients spend less time in the hospitals, the importance of patient education, a type of communication, is increased. We also know that non-communicable diseases are those diseases that are killing most Americans, and they have a very large preventive component. In other words, if we can communicate clearly how to stay healthy and well, will decrease the risk of patients suffering from and dying from these diseases. As part of communication, we can look back on our last topic. We certainly need to understand the patients, their needs, their perspectives, and it's also important to understand that the better we get at communication, the faster our patients will recover. Communication has some issues in the healthcare setting. Okay, the healthcare setting can be intimidating, it's anxiety promoting, patients are often fearful, and we know that poor communication can lead to fatal errors. One of the terms around communication is health literacy. This is the ability of patients to obtain and process basic health information. It should be our goal to help our patients become health literate. We want our patients to be able to use health information for themselves and their families in order to recover, in order to manage their conditions, in order to stay well. When talking about communication, when digging in further, we need to acknowledge that it's more than talking and listening. The type of communication we should be seeing in healthcare is called therapeutic communication. This type of communication is aimed at the patient as the center, and it really requires developing and applying specific communication skills. The process is outlined here. Anytime you see a process, you'll probably see a test question, but we'll walk through each of these steps. And here you see them laid out in image form. So the first step is to decide what your communication goal is. Okay, it may be to update the patient on his condition. It may be to gather information about the patient's lifestyle at home, but you have to decide what it is that you would like to accomplish, and you need to be clear and accurate. Here are a few examples of goals. There could be many different goals in the healthcare setting. With each communication goal, you should show sincere concern for the patient. You need to establish trust, and you also need to enhance the patient's self-esteem. Okay, so this is communication with the patient at the center. True or false? Today's healthcare services are so technologically advanced that there is little point in allowing patients to participate in making decisions about their health. And that is absolutely false. We've shown that patients often make more conservative and better decisions when allowed to be part of the decision-making process. So step one is setting communication goals. And of course, you need to consider that patient as an individual, their level of understanding, the emotions at play, physical factors, how quickly the patient needs the communication or the message. Step number two is to create the message. Okay, that this would be based on the information you've gathered and the communication goal. Generally, you want to avoid technical language, medical terminology, and use general, simple language. This can be different, though, however, in the case of your patient being a doctor or a nurse, but for the most part, you want to find out what their comfortable level of language is around health and medicine and work with that. Your message should be clear and accurate. You want it to be organized. You shouldn't be bouncing all over the place. It's often helpful to break the information into smaller chunks of information. And your message can be of different types. When we talk about questions, we discuss closed-ended, which you could answer with one word. Okay. Have you ever had high blood pressure? Has your blood pressure ever been high? And the answer is yes or no. Or open-ended, which requires more than a one-word answer. Tell me about your past doctor visits with regards to issues around your blood pressure. Questions can be probing, asking for more information, or leading. We like to avoid leading questions for the most part because leading questions include the possible answer in the question. What is your date of birth is an example of an close-ended. Short phrase, functions like a word. Therefore, we call it close-ended. An appropriate use of a leading question is with patients who are unable to offer complete answers. That's true. It can be helpful when patients are having difficulty in the communication process. When asking questions, you need to allow time for a response. Be careful of the leading questions and reword questions when necessary. Use humor carefully. For some, it's appreciated. For other, it's not. So you need to be careful with humor. Some patients like that. It makes them feel at ease. Others feel that you are then dismissing their concerns. In terms of the patient and humor, patients might joke to mask fear. So you need to listen beyond the joke. Listen carefully. Step 3 is to deliver the message. You need to address patients directly, both young and elderly, and everything in between. For adult patients, you should use their titles, Mr., Mrs., Doctor, Professor. It's best to ask the patients how they wish to be addressed, but don't default to the more casual. So don't start with Sue. Start with Mrs. Smith. Can I ask you a few questions? Or Mrs. Smith, is that how you would like to be addressed? Take care around privacy. And even if a patient cannot speak, remember that you still need to maintain communication. Using casual words like and you know in your messages can help them feel more at ease. That's false. Filler words should be avoided for the most part because they're distracting. Nonverbal communication delivers up to 70% of the meaning of an oral message. So this is everything besides the actual words. Your tone, your touch. It can include your body language, gestures, smiling, crossing arms, rolling eyes. Nonverbal communication includes facial expressions, and you should avoid showing negative reactions. And it can include the physical appearance of the healthcare professional as well. So all of that shows a message. Leaning toward the speaker when you are listening is usually a sign of interest, shows interest in what the speaker is saying. The physical environment can affect the delivery of the message, so you need to consider your light source, the sound distractions that are occurring, whether it's a private setting, whether you can focus on the patient, and whether that patient is comfortable. Now, the fourth step is listen to the response. Listening is more difficult than you might imagine. It's a very active process. To listen well, you need to concentrate, you need to attend, you need to observe. What is the most important characteristic of active listening? Focusing fully. I worked with a dietitian many, many years ago. Dietitians go into the patient's room and gather information um, to complete a nutritional assessment. We usually carry in a little pad of paper and take some notes, but this dietitian did not. He wanted to listen actively. And then he left the room and jotted down the notes. So it's focusing fully. It's avoiding mental arguments. So don't have a running argument going on in your brain. Listen to the patient and don't focus on your next response. Listen to the patient. The fifth step is offering feedback and seeking clarification. This is very, very important in healthcare. This is to make sure that your receiver is understanding your message. So some of the feedback is paraphrasing, rewording the sender's message. So, Mr. Jones, what you've told me is it is reflecting to perhaps add more to the original message. It is asking questions and requesting examples. So after you've listened actively, then you offer feedback and seek clarification. I hear you saying you feel better after you've done the exercise I taught you last week is an example of paraphrasing. So finally, evaluate the encounter is number 6. Determine if your goal was met. If not, determine where things went awry. And of course, you're continually evaluating throughout the encounter. Remember that communication is important at each stage of the life cycle, but it is tailored to the patient, the individual, so it may be different for children. You want to make sure they're not afraid. You want to involve them in the process. For adults, don't assume they understand. Teach back is used commonly in healthcare. Teach back is when you say, okay, we've talked about the proper way to take your medication. Now I want you to pretend I'm the patient and you teach me. For older adults, there's a great variation in levels of health literacy. You want to be respectful, and you may need to discuss age. Keep in mind that there are a number of communication barriers that can block effective communication, and they're listed here. So you need to identify them and then problem solve around them. How will you deal with a language barrier? How will you work with a patient who is withdrawing? How will you work with a patient in pain? Terminally ill patients have special needs because they may experience lonely, they may be fearful, experience loneliness, they may be fearful, and health professionals need to come to terms with death as a patient outcome. Patients in pain, communication changes. You may need to identify yourself, which you always should do, but say the patient's name, speak slowly, short messages, try to schedule the best time for the patient when they're less likely to be in pain. For patients suffering from dementia, you don't want to confront them about their errors, okay, their thinking that does not correlate with reality. You don't argue with them about that. Use short sentences. You can distract or agree when the patient doesn't make sense. Respond to the patient's feelings, however, and offer suggestions, not corrections. Depressed patients, invite patients to open up, offer hope, but don't tell the patient to cheer up. Depression is more than that. You can't just cheer up. That really is a belittling response, and allow for silence. An anxious patient, you need to remain calm. Monitor the anxiety level, keep the message simple, stick to one topic, and use feedback. If a patient is hearing impaired, make sure you check for understanding. Be sure that your face and mouth are visible because a patient might be reading your lips. Speak slowly and clearly. Don't shout. Make sure there are no background noises which can interfere with the patient hearing your message, and announce when you're changing a subject, because that can be confusing for patients who don't hear each word. When a listener leans forward and turns his head, this may be a sign of a hearing impairment. For patients who are visually impaired, you want to announce your presence, identify yourself, explain what is happening, what the sounds are, what the procedures are, give very detailed instructions. Tell the patient when you're leaving, give information about the area if the patient is leaving. For speech impaired patients, you can allow them to use gestures, drawings, pictures, communication boards, computers. For angry patients, remember this is an emotional response. There can be loss of personal control, and it can revolve around worries and fears. So first of all, the healthcare professional should not take this personally. You need to remain calm. Don't respond in anger. Don't argue. Listen, answer questions, and if you need help, ask for help. If a patient doesn't speak English, you need to empathize with the situation, but find someone who can interpret. Best not a family member, because they may not interpret accurately. Speak slowly, repeat message in different words. You can use gestures, pantomime, write the message as well. For communication on the telephone, this is so important. You want to really have a friendly voice, speak clearly, speak at a moderate rate. You need to, across the telephone wires, actually show that patient that you are focused entirely on them and on their concerns. Here are a few more guidelines. Don't chew gum or eat when on the telephone. For patient education, this is so important. Patients need to be empowered to take care of their own health, and for that they need education. So education follows a lot of the same rules as communication. You can see here the process is very, very similar. It can be group, it can be one-on-one, but you need to make it clear. You need to work to your audience, be organized, speak at a moderate rate, and be sure to be watching your audience. Remember, you can learn a lot from watching them. Gossip is unnecessary and negative and should be avoided at the workplace. If you happen to be present when someone begins to gossip, explain how it's unfair, inappropriate, and change the subject. And not a small thing at the end of this mini lecture, patient privacy is mandated by law. So you need to make sure you don't speak about patients in public, in social conversations, online. Do not discuss patients in front of them if they are not included in the conversation. Okay, on to your response.